Imagine not being able to read the paper because your hands were shaking. Imagine not being able to read newsprint as your world faded to black. The National Federation of the Blind, Newsline, Indiana. With your host, Lee Martin, and co-host, Florence Myers-McSwine.
We want to welcome you to the National Federation of the Blind Newsline show. And I'm your host, Lee Martin, and we have our co-host,
Florence Myers-McSwine.
And we want to say thank you once again for joining us and watching our show. For those of you that have not watched our show, we are a show that, well, we still believe that literacy is still fundamental, right, Florence?
It certainly is.
And with that, we offer a free service through the National Federation of the Blind, one of the many services that the National Federation of the Blind offers. So we want to talk a little bit about that service. It's a free service for individuals that have not had the opportunity or the privilege to read print. To many people that can read print, that sounds a little frivolous maybe, but if you can't, it's a big deal. And if you watch our commercials throughout the show, you'll find a lot of contact information, and you'll see a lot of individuals that utilize the service and the value of the service to them in their daily lives. This free service allows individuals to access over 500 publications, newspapers, magazines, TV guide listings, job listings, which is very important with the high unemployment rate that we have within the blind and disabled community. And for those of you that don't know, that's up around 70 to 75% of that population without adequate employment. So we use these services so that individuals can stay informed. It's an audio information service. You can use your landline phone. You can use your Apple app that we have, a very good tool. We can also use what we call a Victor Reader Stream. And the digital talking player, which is a free talking player that you can get from our state sponsor for this service through the Talking Book and Braille Library Services. So there's a myriad of ways that you can receive these free services. Florence, you want to talk a little bit about the magazines?
Yeah, so how about access to Indianapolis Monthly or the Indiana Business Journal? Those are two of the magazines that the NFB Newsline has. There's also WebMD magazine, Guidepost, Reader's Digest, just to name a few. So if you love reading newspapers and magazines, check out the NFB Newsline. You'll love it.
So we're going to take a short pause, and we'll be right back with our guest. She has some very informative information to share with us all. So we'll be right back. Stay tuned.
If you or someone you know is visually impaired or print challenged, the National Federation of the Blind has a resource you need.
I use NFB Newsline when reading Hammond Northwest Times.
Using NFB Newsline, I read the Christian Science magazine.
Dad, you read Jerusalem Post, too.
Learn more by calling 855-963-6476 or visit nfbnewsline-in.org.
Live the life you want. Read NFB Newsline.
It's free. Thousands of Indiana residents feel isolated from the world due to vision problems. Thanks to the National Federation of the Blind, visually impaired Hoosiers can hear newspapers, circulars, and magazines from across the globe.
I'm a Vietnam veteran. I'm blind. I read Stars and Stripes on NFB Newsline.
Learn more by calling 855-963-6476 or visit nfbnewsline-in.org.
Subscribe free to NFB Newsline.
Welcome back to the National Federation of the Blind Newsline, Indiana, with our guest, our special guest today, Miss Latrice Jeter from the Indianapolis area. And Ms. Jeter, welcome to our show.
Welcome to the show.
Thank you for having me.
Ms. Jeter, now you are here today to talk about some things concerning Medicare.
Yes.
And can you tell us what you would like to discuss today, and tell us a little bit about what you do.
Okay. Well, what I do, I have an insurance brokerage, and the name of it is Simplified Insurance Solutions. And the goal with this brokerage is to educate the senior community and those with disabilities that receive Medicare so that they can make more informed decisions. You know, there's a lot of different options and choices when it comes to Medicare Advantage plans, Medicare supplement plans, prescription drug plans, dental, vision, hearing plans. So what we do is to narrow down those different options for them, make sure that they understand Medicare Parts A, B, C, and D, as well as the different options available to fill in those gaps that Medicare doesn't cover.
Okay. And now, I'm a person, I don't know much about Medicare itself. Okay. Let's say, for instance, I receive Medicare, and I know that the way that you're describing it is that there's a plan, individual plan for every individual, correct?
That's correct. Once you enroll in Medicare, you're automatically enrolled into Medicare Part A, and there's no premium with Medicare Part A. And when you think of Part A, you want to think of hospitalization or inpatient coverage. There's a deductible of approximately $1,360 per inpatient stay. And then you can, as an optional benefit, also accept Medicare Part B, as in boy. And with Part B, that's all of your outpatient services. So think of doctor visits, durable medical equipment, emergency care, things like that, ambulatory care. And with Part B of Medicare, you have a monthly premium, and that's $135.50 is the standard for 2019. And then in addition to that, you have another deductible for outpatient services, and that's $185. But after that deductible, Medicare is then billing you 20% of the amount for services rendered, and they're paying 80% of those services. And that's unlimited. You continue to pay that 20% for those outpatient services. So that's where the Medicare Advantage and Medicare supplement plans come in, is that they help to offset those costs. So some of the supplement plans, the Plan F, for example, will pay 100% of what Medicare doesn't pay. So then those deductibles go away, the co-pays, the co-insurances. The Medicare Advantage plans, on the other hand, and we all see those commercials, you know, some of them have zero premiums. Many of them are very low premium plans. You can opt for zero deductibles, zero copays for your primary care visits and things like that. So it simply lowers those out-of-pocket costs for you to offset, you know, the Medicare expenditures. The other portion of Medicare Part D is prescription drug coverage. And so you definitely want to have a prescription drug plan. If you don't and you have Medicare, you're actually penalized once you do go to pick up a prescription drug plan. So from the time you receive Medicare, you want to at least always have a prescription drug plan in place.
Okay. Latrice, now for a person that's just now becoming eligible for Medicare benefits, and they have Part A, considering Part B, is there an option to pick up the Part B for that person?
Yes, absolutely. If you qualify for Medicare Part A, you automatically qualify for Part B. And so if you're wondering why would someone not take Part B, remember Part B has that premium of $135.50 per month, you know, this year. And it changes a little each year. If you don't pick up Part B right when you qualify for it, when you first enroll into Medicare, then there's a penalty as well if you decide to take Part B at a later time.
Okay, now you've got a lot of information concerning Medicare. Now, tell me a little bit about you, Ms. Jeter. How did you get into Medicare Advantage, or is this considered Medicare supplements, or How do you categorize this?
I offer both the Medicare Advantage plans and the Medicare Supplement prescription drug plans. How I got into this industry, I started off at United Healthcare as a licensed insurance agent. I was the regional marketing manager as well as a brokerage account manager. I worked there on 2 different occasions. And then when I left there, I went to Health Plan One. It's a large insurance brokerage as well. And I was the vice president of business development by the time I left there. But I started off there offering Medicare to seniors and those with disabilities, and just kind of switched over a couple years into it to the business development side. So I was the director of business development turned VP of business development. And then when I left, my goal with starting my own brokerage was simply to get back into our local community and start to educate those that qualify, for Medicare, of what their different options are. And that really is my goal with each client that I sit down with, is to make sure that they really understand what they have currently, what's available to them. There's a lot of additional benefits out here that many seniors and those with disabilities aren't aware of, such as low-income subsidies, extra help, programs that are available to lower and help offset even their prescription drug costs that are of no charge to them. But they're just unaware of a lot of these different options to lower those out-of-pocket costs. So I just want to make people, more informed so they understand what's available and save some money in the meantime.
Mm-hmm. Now, if there's a person that has a pre-existing condition, are there penalties for that, or how do you work with those individuals?
That's a good question. With the Medicare Advantage plans, pre-existing conditions don't come into play. So if you qualify for Medicare, generally you qualify for a Medicare Advantage plan. Now, with the Medicare Supplement plan, then pre-existing conditions can come into play. If you don't opt for a Medicare Supplement plan within the first 6 months of qualifying for Medicare, then it would be medically underwritten and pre-existing conditions would be considered. And the insurance carriers can either decide, yes, we're going to accept you, or they can decide, no, we're just not going to insure you. Or they can also do what's called a rate increase, where they, increase your monthly premium based on your pre-existing conditions. Many of the plans also, if you have pre-existing conditions, will have, clauses in it that say, what they will or won't cover. So those are some things to consider when considering a Medicare supplement.
And once again, this is income based on individuals' income or age?
It's based on age as well as location when they're pricing the plans. Mm-hmm.
Okay, so an individual such as myself, I'm a veteran, and I use the Veterans Hospitalization Insurance. And I also have, let's say, like Medicare. Is there any advantages to, having both, or disadvantages to that?
There are advantages to having both. As a veteran, you have the Veteran Administration benefits. Most often you can use those benefits within the VA. But if you qualify for Medicare, you can also have, in addition to that, either a Medicare supplement or a Medicare Advantage plan. With the supplements, there's no networks of doctors and hospitals. So that gives you the freedom to choose what doctor or hospital you want to go anywhere in the country and be seen, as long as they accept Medicare. With the Medicare Advantage plans, there are networks. There's health maintenance organizations, provider organizations, and a couple of other options. But you must remain in the network to see those doctors and hospitals. So if you take both, then you have your VA benefits in addition to having your Medicare coverage and your additional Medicare benefits. So again, it just lowers your out-of-pocket cost even more and gives you more options of where you can go and who you can see.
Okay, well, we're going to take a short pause, And we're going to come back and learn more from Ms. Jeter. And, you know, I just want to thank you for coming on and sharing such great information. And, wow, you're so astute at what you do.
Thank you.
You know. So we'll be right back, so stay tuned.
I just graduated college as a blind student. How can I independently find job listings?
Thanks to the National Federation of the Blind, visually impaired Hoosiers can hear newspapers, circulars, and magazines from across the globe.
It is a fantastic service.
Learn more by calling 855-963-6476 or visit nfbnewsline-in.org.
We are the nation's blind, and we read NFB Newsline.
If you or someone you know is visually impaired or print challenged, the National Federation of the Blind has a resource you need.
Wow, I scored a touchdown when I found sports on NFB Newsline.
I enjoy reading TV guide listings on NFB Newsline.
Learn more by calling 855-963-6476 or visit nfbnewsline-in.org.
We are the nation's blind. We read NFB Newsline.
It's free.
We want to welcome you back to the National Federation of the Blind Newsline show, and we have a guest here, Ms. Jeter, and she's sharing some great information about her business and about Medicare. So we're going to resume our conversation here. So let's go ask the question here about you know, at what is there a particular age that or time that you have to apply for Medicare?
When you turn 65, you are automatically enrolled into Medicare Part A, and at that time you can choose to enroll in Medicare Part B, a prescription drug plan, or a Medicare Supplement or Medicare Advantage plan, in addition to Medicare Part A. Those with disabilities, you're automatically enrolled after a period of 12 months. There's a short wait, and then they just automatically enroll you. And if you enroll in Part B, the premiums for Part B are taken out of your Social Security check. So it's just automatically deducted once you're enrolled. If you do not enroll in Medicare Part A and B, then you do not qualify for a Medicare Supplement or a Medicare Advantage plan. So you must have both Parts A and B effective to qualify for additional coverage.
Okay, now, Ms. Jeter.
And that's for a disabled person as well, right?
That's correct.
Okay.
Now, with the, you've got a lot of good information, and it's a lot of information that I, as well as many others, aren't aware of. You told us about how you started your company, but your name, Simplified. How did you come up with that?
I was just trying to think of what my goal was and what my vision was. And again, that's to make Medicare simple and explaining it, make sure that, you know, my clients are educated and informed about the different options and how this all pulls together for them personally. So I thought, what better name than Simplified Insurance Solutions, because that is the goal, is to simplify not just the process of you know, educating them, but also what happens then. So I also assist them with the enrollments, and then I'm available moving forward with any questions. It's a free service. So I welcome people to just call and say, hey, I just have a quick question about the coverage that I have now, or, you know, a coverage that was offered to me. And so there's no pressure to enroll into anything. If what they have is what's best for them, then I explain to them, this is what you have and this is why you should keep what you have. You know, so again, it's all around simplifying all of these different options and letters and all those different numbers and premiums. And so Simplified Insurance Solutions.
Okay, and you serve the Indianapolis area. Are there other areas that you cover as well?
The entire state of Indiana.
Okay.
So you do you have a team, or how big is your Simplified?
Right now it's myself, and I have 2 agents that are coming on this year that'll be working with me.
Okay, and you do group speaking as well
I do.
on this?
I do presentations, and that's free of charge as well, just to educate, So I show up in either 30 minutes, an hour, and just review, a Medicare overview of parts A, B, C, and D, the different deductibles and premiums. And then I like to, get a little more deep into what the Medicare supplements offer versus the Medicare Advantage plans and prescription drug plans.
Now, if a person loses their sight, like I did at the age of 48, how would you go about getting them into the Medicare process?
Well, once you are receiving your Social Security and disability benefits, again, you're just automatically enrolled in a Medicare Part A. So you just receive a notification once you qualify that you've already been enrolled in a Part A. And upon receiving that, you want to act, quick and go ahead and enroll in Part B. Because again, if you don't enroll in that when first eligible, there's a penalty if you decide that you want it later. You can only have Part A or Part B for, a prescription drug plan, but keep in mind you must have both Part A and Part B to then obtain the additional coverage in the form of a Medicare supplement or a Medicare Advantage plan. And many of those, the Medicare Advantage plans actually include prescription drug coverage.
Now, for a person, let's say, who has Part A and Part B Medicare coverage and still seem to feel that they're paying a lot out of pocket, like, for instance, some people who might be diabetic, is there special plans or advantages that they may have as well?
They do. They have plans that are called special needs plans, and they have chronic plans, and so those are focused around those with chronic illnesses. And so the benefits, they're benefit rich, specifically, focused on what their disability is or what their chronic condition is, if that makes sense. So they really load on the benefits for that particular medical condition.
Okay. Now, do you go to your clients' homes, or do they come to you? How does that work, Ms. Jeter?
I can work over the phone to answer questions and even complete enrollments. They can come to my office, and that's at 9165 Otis Avenue, and I'm in Suite 210 in Lawrence, Indiana. It's by Fort Benjamin Harris. And I can go out to their home if it's local. They can call, and I can just schedule an appointment and go and meet with them if they prefer.
Okay. Do you have an office phone number that you would like to leave as well?
Sure. My office phone number is 888-340-7633. And as far as the different carriers that I represent, when I say that I'm a licensed insurance broker, that means that I represent the major carriers as well as many of the regional and even some local carriers. So that would be, United Healthcare, AARP, Anthem, Cigna, Aetna, Humana, that list goes on, Mutual of Omaha. So that's always beneficial for my clients as well, because I'm not just discussing one carrier with them. I can look at all the different options available, in their particular zip code and make sure that we're discussing what's going to benefit them the most.
Okay, so it is not particularly age geared, it's more Medicare geared. Correct. Okay.
Well, I am, there's so much information to share to people that really are, don't know, because I know for myself as I'm sitting here learning from you as well. And I know many of our listeners and viewers be glad to have your services. I know I'm looking forward to talking to you some more.
Thank you.
And we'll be right back to conclude our show, so stay tuned.
Federation of the Blind knows that blindness is not the characteristic that defines you or your future. Every day we raise the expectations of blind people because low expectations create obstacles between blind people and our dreams. You can live the life you want. Blindness is not what holds you back.
Thousands of Indiana residents feel isolated from the world due to vision problems. Thanks to the National Federation of the Blind, visually impaired Hoosiers can hear newspapers, circulars, and magazines from across the globe.
I'm a Vietnam veteran. I'm blind. I read Stars and Stripes on NFB Newsline.
Learn more by calling 855-963-6476 or visit nfbnewsline-in.org.
Subscribe free to NFB Newsline. I want to welcome you back for the conclusion of our show with the National Federation of the Blind Newsline. So, Ms. Jeter, tell us why it's very important for this information to get into the hands of your consumers.
I feel it's very important because having, been in this industry for 15 years now, there's a need for education, an ongoing need for seniors and those with disabilities and those that qualify for Medicare to be informed. There's so many options out there. It's hard, if you don't work in this industry daily and discuss this daily to determine what's right for me. So in working with clients, my goal is just to, based on their specific needs and their specific budget and their specific circumstances, narrow all those options down and help them determine what's going to be the best, benefits for them to meet their needs, but also what's going to save them the most money. That's the goal, is just to educate and to make sure people save money, because there's so many benefits out here that consumers are just uninformed about, they're unaware of, misinformed. I talk to a lot of clients that just do not have accurate information. So that's the goal with what I do, is to educate and save money, help people save money.
Okay.
Yeah.
All right. And on that note, Ms. Jeter, we'd like to thank you for coming on to the show and sharing that information to our audience. And to our viewing audience, we welcome you to again join us next week on the National Federation of the Blind Newsline, Indiana.
The National Federation of the Blind, Newsline, Indiana. For more information, go to nfb-in.org or call 855-963-6476. That's 855-963-6476. The National Federation of the Blind encourages you to live the life you want.